everyone, and welcome. Thank you for taking just a few minutes to come and join us today. And once again, Jim, thank you. Thank you for taking the time to visit Cornwall Community Hospital and for sharing your great news. I think everyone here knows that last year we experienced challenges around our patient wait times in the emergency department, with our waits being sometimes above provincial targets. These challenges were a result of factors impacting the flow of patients through the emergency department. We had a temporary reduction in medical manpower, leaving us short of optimal physician coverage. For example, while we would normally have 4 physicians working in a 24-hour period, we often had just 3. I highlight a temporary reduction in manpower because since March of this year, we are back to a full complement of physicians working in the department, and today results show a very significant improvement in wait times. The second factor contributing to our less than desirable performance was the very high number of patients admitted in the emergency department waiting for an inpatient bed. The pressure on the inpatient beds was caused from the excessively high number of patients no longer requiring acute care services or our ALC patients. We are pleased again with the support from the province and the Champlain Glen. Several initiatives have been targeted at reducing these numbers and improving the placement and the quality of life for our seniors. As an immediate measure, 20 extra beds are opened at our McConnell site in August of 2010, with a longer-term plan to develop a more appropriate setting at 2nd Street. Just recently, we received confirmation that these 34 beds would be operated by St. Joseph's Continuing Care Center. These additional beds, combined with the increase to community support programs through CCAC, are contributing to improvements today and are expected to help us ensure timely access to the critical and emergency care our community needs. Emergency department wait times are determined provincially by measuring the wait time in hours that 9 out of 10 patients spend in the emergency department. So from the time the patient arrives at triage to the time that they're either sent home or admitted to an inpatient bed. Our May results, May 2011, clearly demonstrate improvement. In 2010, our patients were spending over 70 hours in emergency waiting for an inpatient bed. In May, these admitted patients waited only 25 hours with the inpatient bed, and that's 9 out of 10 patients. These May results are consistent with what's happening across the province and with the provincial target. Today, we are on target for meeting provincial benchmarks of 4 hours for minor or uncomplicated conditions, a reduction of 1 hour since last year. We are also trending to meet our performance for complex and serious conditions from 10 hours to 9 in 2011. These are critical patients that come into emergency, have all their testing done, cared for, assessed, and sent back home. Beyond wait times, it is our desire to improve the patient experience while in the emergency department across the hospital. As Jim has indicated, we have been approved as a participant in the ED-PIP provincial program. This emergency department process improvement program is a component of Ontario's wait time strategy and is designed to support improvements to hospital flow. ED-PIP, as it is known, uses a lean improvement approach based on learnings from industry and healthcare transformations in Ontario and globally. Improvement teams within the hospitals examine patient flow from end to end, from arrival to ER through discharge from an inpatient bed. We appreciate this exciting opportunity to examine our patient experience and to improve. Once again, I want to thank Jim Brownell for his support. Jim has always been a friend at CCH. We were fortunate to have Jim in Toronto in 2005 when we were seeking approvals for our capital redevelopment project. This busy construction site today would not be a reality without those approvals and our position on that provincial infrastructure list. For years, literally years, Jim met with us, arranged meetings, and advocated for appropriate base operating funding for CCH. We received a $5 million adjustment in 2010 with that support. The list goes on. Recognition of our ALC challenges and the needs for additional beds was supported by Jim and taken to Toronto. We will miss you, Jim, and today we wish to formally thank you, to wish you good luck, and express our good wishes for a happy, healthy retirement.